One of the really unique things we have here at Washington University is that we have the backbone and history and legacy of a place like Washington University supporting what really is the City Hospital of St. Louis. Most places you either have an academic center or you have a hospital that serves the community, but rarely do you have both, and here we get to have both of those features. And what that means to our residents is when they come to work with us, they get to take care of not only the penetrating trauma and sick patients that you'll see from a city population, but you also take care of kind of the rarities that you only see at a university teaching center. Our four-year curriculum, I think you can divide it up into kind of a basic theme for every year. So our first year is really kind of getting your feet wet, and it's about getting you into the clinical environment and exposing you to kind of your core curriculum, like the medicine month where you're on the floor managing medical patients. You get some exposure to the ICUs, you get to go to the CT ICU and work with some sicker patients there. You'll actually spend a fair amount of time in our emergency department while you're going through that phase as well. And while you're in our emergency department, for the most part, you're under the kind of guidance and supervision of one of our senior residents. So one of our teaching residents, we will guide you along through your patient care. And it's great from two aspects. It's great when you're the senior resident and you get to do some education and help train new learners. But also as a junior resident, it means you get to take care of much sicker patients than I'd otherwise allow you to. So you'll see here as an intern, you'll be taking care of patients that I would argue are sicker than patients that most people in their third year will be taking care of. And that's because we have that senior level resident helping you along. You're not just kind of left to flounder on your own, and I can then trust you with those sicker patients. Your second year becomes, from the ER standpoint, it's your time to really get your feet wet with moving the meat and getting through a lot of patients while you're working in the emergency department. You spend most of your time in our EM2 area. It more closely resembles what I would call a community emergency department. And while you're working in that area, you'll be responsible for what really is the main area for moving patients through our emergency department. Our EM1 area gets bogged down with psychiatric patients sometimes. Our critical care area gets bogged down with sick critical medicine and surgical patients. And you're really the place the ER is relying on to crank out patients. And during that time, you're kind of the supervising resident in that area. You have an off-service resident you're working with, but you're the one who's in charge as a second year. And then that's offset by a lot of critical care exposure. So you'll do the surgical ICU, the neuro ICU, and the pediatric ICU during your second year. And then we kind of intersperse with that our lighter rotations, some of our administrative rotations and your research rotations, so that you might have a really hard clinical month in the ICU, but then you get kind of a lighter month where it's mostly office-based, no call, things like that. Then our third year is where you start to really take on the leadership role as a senior resident in our critical care area. So you'll become responsible for the thrust of trauma critical care. You're responsible for moving the patients through that area. And then outside of the emergency department, you'll do a medical ICU month. And then we have our education month, which is a new component of our curriculum, and we have you responsible for a couple of lecture components during the month under the guidance of myself and Rebecca Bavlik to really help you develop yourself as an educator. Because really, even if you don't go into academics, you go into just clinical medicine, you'll be an educator for the rest of your life, whether you feel like that's going to be the case or not. People are going to rely on you for education forever. So we're really helping trying to mold the educators and help you become the best educator you can be during that month. And then finally, the fourth year, that's our year where we have some elective time and you get a little more flexibility in what you want to do with your schedule. International medicine's a big one for a lot of our graduates now. And then most of our residents spend a month in Hawaii as well for an elective, where you get an apartment and a rental car and you work a dozen or so shifts, not a half dozen, a dozen or so shifts and get a lot of downtime in Hawaii. And most of our residents enjoy that month as a fun exploration as well as kind of a paid vacation.